Yeah, I missed you. You just cut down. Okay, we are live now. Okay. Hi, everybody. Hello. I'm happy to have you today. I'm hosting today. I'm Buthaina Osama. I'm the regional coordinator of SciDevNet for MENA region. And my guest today is Sophie Desoulieres, head of MSF Amsterdam Humanitarian Affairs, Operational Communications and Advocacy Department. Actually, Sophie started her work with MSF as a humanitarian affairs advisor, supporting operations in Northeast Syria, Iraq, Jordan, Pakistan, Afghanistan, Yemen, and Venezuela. Prior of joining MSF, Sophie was a senior analyst with the International Crisis Group covering Afghanistan and Pakistan. Sophie holds a master's degree in anthropology from Université de Provence, Maison Méditerranéenne des Sciences de l'Homme, and a Bachelor of Art from McGill University. Sorry for my bad French if it was bad.
Yeah,
um,
perfect.
okay, hi Sophie. Happy to have you today. Um, can we start our questions about how do you see the pandemic's impact people in such a prolonged conflict in a place like Syria?
Well, thanks
Just
for
give us an
having.
overview. Yeah.
Sounds good. Thanks for having me today, and also for the opportunity to speak about a context that is close to my heart and close to MSF's operations. The context today, a year or over a year into the COVID pandemic, is quite bad, as you can imagine. It's just further exacerbated a situation that was dire. It's an area where access to healthcare is severely constrained, where the impact of conflict is very direct in terms of the effect that it's had on populations, on displacing people, on lives lost, so on and so forth. But it's also had that indirect impact where it's really weakened the public health infrastructure. In Northeast Syria, we've seen over 15,000 cases of COVID, and now we're full on into a second wave. So the increase in positive cases is humongous. We've gone from about 6% positive cases in February to close to 50% last month. We're also seeing it in terms of the admissions that we are getting in the treatment centers that we support. And this is having an impact as well on healthcare providers, because we're seeing it in terms of the rate of infection among medical health workers. And when doctors and nurses cannot go and do their work, that impacts the entire population's access to healthcare.
Exactly. Yeah. Okay. As you mentioned, the health system in North Syria, is already deteriorated, right? Um, with the heavy pressure of the COVID-19 on this deteriorated health system, how MSF efforts are supporting the system?
Of course, yes. So we are in Hasake and Raqqa, supporting directly with the COVID response in terms of case management, trying to coordinate the response, um, community engagement activities as well. In Mishlab, um, treatment center in Raqqa. We also have a presence in the emergency room, in the outpatient department. We're also supporting with non-communicable diseases, because chronic diseases and the availability of medication and treatment for chronic diseases in Northeast Syria is quite limited. In Ain al-Arab, Kobane, we're also supporting with the national immunization program that has also been severely constrained throughout the war in Syria, where the access for the population in Northeast Syria to the country's routine immunization program has been has been limited. And then finally, we're supporting with water delivery, safe drinking water delivery in Al-Hasake, water provision being a major issue in the region. And we are also present in Al-Hol camp, which is a camp that houses over 60,000 people who have been displaced from the last bastion of control of the Islamic State, and where services are very, very limited. So we've been supporting that area with water and sanitation services, but also with a clinic and specific mobile wound care facilities as well.
Mm-hmm. And how is the vaccination to COVID-19? Is there a campaign of vaccination? How MSF is helping with this? Is it available, the vaccination for COVID by first place?
COVID vaccination is one of our big concerns for Northeast Syria, because we know that access to the vaccine is going to be limited, just as it has been. If we look at how, as I was telling you, if we look at how this region of Syria has received limited resources from the National Immunization Program, we can fear that the rollout of the vaccine in that area will be limited. So that is definitely a major concern in terms of that rollout in the region.
But there is some kind of amount of vaccinations is done there.
There are a number of vaccines that have been promised through the COVAX mechanism to Syria. Now it remains to be seen how many will reach Northeast Syria.
So until this moment, the vaccination for COVID haven't started yet in North Syria?
Not to my knowledge, and not with involvement of MSF for the moment.
Okay. As you said, MSF is giving the support it can for this part of the world under the conflict. But what do you think the role of other international health organizations that should be played? And what is the support still missed badly in this hotspot of the world?
It's a complicated area to operate in, and whatever we do as MSF is a drop in the ocean, but also for humanitarian organizations throughout. What is severely affecting the ability of humanitarian organizations to provide services in Northeast Syria is the fact that so there are service provisions that are provided from organizations that are based in Damascus, and others that are provided, like us, through organizations that operate cross-border. There is a lack of coordination between those, but specifically, there is a lack of ability of organizations that are based in Damascus to be able to prioritize certain needs in Northeast Syria. So we're seeing it with vaccination. We've seen it as well with the massive number of informal camps that have been set up in Northeast Syria. We saw it particularly after the Turkish-led military intervention, where people were displaced. These are areas where the UN apparatus based in Damascus cannot respond to without the authorization of the Syrian government. And that has severely constrained the scale of the response. So what would be needed in this area would be, well, first, a much more coherent mechanism, an ability to be able to work there based upon the level of needs, to be able to provide what is much needed. And what is much needed is what I've listed earlier, but also a number of essentials to boost up and to boost back the health system, right? So, for example, Raqqa National Hospital is the only secondary level facility providing free access to care in the area. There needs to be much more availability of care. There isn't, for example, burn care is not available for severe burn victims. And we know that this is a major issue of concern in Northeast Syria. We saw it ourselves in late February in a fire that injured a number of people, including people who worked with MSF in Al-Hol camp. And these are services for of care for wounds that are not available. Mental health services as well are severely lacking, and you can imagine that a population that has suffered and continues to suffer the impact of war is in dire need of mental health assistance.
Yeah.
Vaccination, and as I mentioned, non-communicable diseases, and these are just a few of the essential needs in Northeast Syria.
Regarding women, how particularly the challenges they are facing in such area, and how international health organizations are helping women in this particular conflict zone.
Yes, and you're right to talk about women, because women in conflict zones always bear the brunt of the conflict. We've seen many women-headed households today that have been displaced multiple times, whose husbands or fathers have died or are detained or have disappeared, and women become the breadwinners, have to survive and have to care for children.
Yeah.
The activities of MSF, all the medical activities are available for the entire population, and they're based on the prioritization is based on the basis of needs. But as we've said, women are often the ones that suffer the most and have the most of these needs. So women feature prominently among our patients in all of the places that we are. In Al-Hol camp as well, specifically, particularly in the area that is known as the Third Country National Annex, which is where the women and children who are non-Syrian and non-Iraqi nationals are held. This is a population that is exclusively women and children. So obviously our medical activities are tailored towards their needs. What we also see is, as women have to become bread earners, a lot of our many of our colleagues, actually, of our Syrian colleagues, are women. There are women who are healthcare workers in the areas where we are working. There are women who have been displaced and who have become our colleagues and who we work closely with and who we admire the resilience of.
What do you think the main challenges there for women? What they really need badly in this particular area, from a health perspective, I mean?
I think from a health perspective, well, there is everything that is related to health, right? Which is, well, safety, security, the financial means to be able to care for their children, for themselves, adequate water and sanitation, so that they can stay safe and their children as well. Their maternal and child health care is definitely much needed. And so these are just a few of the essential needs for women. There are the specific issues that women face, and then there are the general health issues of the population that affect women and that affect women sometimes disproportionately. So obviously chronic diseases, women are not immune to those and suffer predominantly from those. Also the fact that health facilities are far apart and are very few. So traveling for women to different health facilities is complicated and can compromise their access to care.
You mentioned to me before air that you have been to North Syria, I think 2 years ago, before the pandemic. Can you mention a story that have a large impact on you? Have you met a patient that make difference in your perspective to this conflict zone particularly?
I've visited our projects a couple of times, and indeed the last time was 2 years ago, and time flies. You know, I mean, when we look at
Yeah.
when I look at what's happened in these past 2 years, between the military intervention in the region, between the COVID pandemic, I can only, well, actually, no, I can't even imagine how much worse the situation has gotten, and the situations of the patients that our colleagues care for. There are many stories, and it's, you know, I mean, the number of the resilience and the number of times that people have been displaced from one place to the other, trying to find safety, trying to find medical care for their children, for their relatives. I remember people arriving as they were leaving Raqqa with, you know, with barely nothing with them. I remember also the people who, and particularly the children, who stepped on mines and booby traps as they were going back home to Raqqa, and you know, children going through their homes and trying to find their toys and being wounded and sometimes dying from the booby traps that had been placed there. But I think what I'd like to tell you about is actually the story of one of our colleagues, one of our Syrian colleagues, that really touched me. This was in Ainisa camp, where people who had fled Raqqa and the fighting in Raqqa were staying. And this colleague of ours is a mental health counselor. So she was working very closely with particularly the women in Ainisa camp. And I remember we were talking, and she was telling me about how she was from Raqqa herself, and she had fled Raqqa, and she had fled the violence there, and she was talking about the repressive regime and the violence of the Islamic State under that time, and the people that she was caring for. Well, some of them were people who were associated with the people that she saw as being violent. But when I asked her how she felt about that, she said, "Well, to me, in my mind, there's no question. Our job is to be there for the people, whatever their side is, whatever their affiliation is, whatever their story is. We have to be there for people in times of need." And for me, she embodied just the essence of humanitarianism.
Yeah. And as a woman, do you think it makes different when you are there dealing with the people?
I think there's a definite proximity in that you can sometimes relate, but of course you have to be careful that, you know, having
Not to
lived
engage too
through
much.
what they've lived through, it's very hard to really understand what that is. But I think as a parent as well, if I may say so, it hits right home, because you imagine yourself trying to care for your children, trying to trying to make ends meet, trying to bring the basics in the situation, and in a situation that seems to never end. It's been over a decade of that. Yeah.
You mentioned a lot El Whole camp as one of the camps that MSF is taking care of. How do you think this particular camp is different, and why it sounds more manageable than other camps in the same area?
So Al-Hol camp is different than many other camps because it is an open air prison. It is managed as a instead of being managed as an area where people who have been displaced from conflict are provided care for. It is clearly treated as an open air prison. It is not unique to the region. We have seen camps like these in Iraq as well, for populations that have left areas that were under Islamic State control during the last battles. But Al-Hol is special in that way, in that it is particular in that way, in that it is different from a refugee or an IDP camp or a camp for internally displaced elsewhere. It is truly a closed open air prison. What also makes it particular, although not different from many other camps, is that the vast majority of its population are children. So you go into a camp that is an open air prison where the vast majority of the population are children.
Have you the numbers? How much people is based there in this camp?
There are over 60,000 people in this camp. It's a mixed population, so there's a diversity of profiles and people that have come from different areas. There's what is called the main camp, where Syrian populations and some Iraqi families as well are staying. And then there's an area that is even more closed off, where women and children exclusively from countries other than Syria and Iraq are.
Mm-hmm. And they are not allowed to go out of this camp?
No, it is an absolute open air prison. It is a collective, arbitrary, indefinite detention, essentially, of children. It's as a parent, it's a particular place to go to. I think as any parent, when you relate when you hear a child speaking the language that you speak with your children. I'm French and Pakistani, and when I went to Al-Hol, I was expecting to speak in Urdu quite a bit. For some reason, I actually ended up mostly speaking in French because there were a lot of Francophone women and children there. Really? And the first thing that I heard when I arrived in Al-Hol was a little child telling his mother, "Maman regarde un ballon." Mommy, look, a balloon. And there was, like the Banksy picture, there was this red balloon that was flying off the wall, and it was flying on the barbed wires. And it's a particular place where you cannot imagine that a child should ever grow up. And this was 2 years ago, and the situation is still the same, if not worse.
And how the pandemic is dealt with in such a camp?
It's extremely difficult. It's extremely difficult. Overcrowded camps with severe lack of water and sanitation. When there is water, when there are latrines, they are not of the quality that they should be. They are not maintained in the way that they should be. So it's very difficult to manage the pandemic and ensure that it doesn't spread in these type of environments. It also health services are very limited in this space. So as I was telling you, with health workers being infected as well, not able to be in those health structures, then we've actually had health structures that have intermittently at different times, we've seen them closed. So that has also impacted population's ability to access care, also non-COVID related.
And how the ill candidates is isolated in such a camp, or how pandemic is managed, if I may say. As you said, it's an open air prison, so where do you isolate the patients, and how to make sure that others will not be infected in such a closed place?
It's extremely complicated, also because testing capacity is severely limited in the area throughout Northeast Syria. So there are a number of health facilities, but they are severely strained. So it's to answer your question in a simple way, it's absolutely imperfect, the way in which the pandemic is managed in a camp such as this one, just as it is throughout the region.
And the medication support, do such camps, not just El Hol, have enough medications to survive the pandemic, or they are facing shortage of such supplements?
Definitely facing shortages. Definitely facing shortages of basic protective gear, of oxygen, which is, as you know, essential. Number of beds, medication is severely lacking, and when it is available on the open market, for example, it's extremely expensive, because getting supplies into Northeast Syria is expensive, and so makes it quite out of reach of a population that has, because also with the COVID pandemic, what you've seen is an exacerbation of the economic situation. So people's livelihoods, so not the camp in specific, but people's livelihood have really been affected. So that has a snowball effect on the healthcare system as well.
So how do you think health organizations could help in relieving the situation with the pandemic in such areas? Is there a way that that international organizations could help to support this shortage? I think there's a way. What do you think?
There definitely is, but it's really a lot about facilitating the access
Yes.
of international organizations, of supplies to that area. That is really what is needed today, so that the essential medications, the essential supplies are able to make it to that area. What is also needed, but is much more difficult to fix, is just simply the absence of, or the insufficiency in numbers of healthcare workers in that area, and that is something that humanitarian organizations alone cannot tackle.
So do you think that the problem is not in fund shortage, but mainly in the accessibility of the supplements to the people there, and the medical staff that need to be there for these people, right?
It's both. The funding situation is a definite issue, because what we see with with many organizations, not MSF, but organizations that are dependent upon government funding, they struggle to have sufficient independence over large funding to be able to have the agility to meet the needs. So, for instance, if there is a specific need at a certain moment, most organizations do not have the funds to respond to that specific need there and then. And by the time the donor funding comes through, that need has evolved. And so donor countries, major donor countries, like the European Union, the United States, and others, need to make their funding much more agile so that international organizations can respond in a much more relevant and timely manner.
Mhm.
But again, I think there's also the fact that the UN response in Damascus often is not able to respond to the needs without the authorization of the Syrian government, which has on a number of times restricted authorizations for the UN and UN partners to respond in that area. So putting excessive or leaving the burden on much smaller responses like international organizations such as ourselves.
Mhm. Okay, I heard from you a bit sad story from North Syria. Do you have such a happy moment that you had there to remember?
That's a difficult one. The happy moments are the resilience,
Uh-huh.
of our colleagues, the humanity that people uphold after living in such horrific conditions. And it sounds trivial, but the sense of humor and the joy of life that continues in areas where everything just seems desperate. When you see children and everything anything can become a toy. All of these are heartwarming stories. And then, of course, when I see the work and the dedication, particularly of our Syrian colleagues, and their ability to put aside very difficult life stories, to be able to put that aside and actually bring assistance and care to populations when they need it the most is just humbling and heartwarming.
So you don't remember a specific moment?
Uh no, I don't think there's one specific moment that I'm thinking, but there's just been so many there's been so many laughs,
Really?
that it's hard to, of course, yeah, because it brings you together, and I think it makes you be able to go through as well what
Mm.
yeah what humanity brings your way. And no, so I just remember the laughs with our colleagues, the the responses from our patients, the sometimes when they've had very, very little access to care, when they've also, sometimes it's simply just the thank you from a patient that doesn't really seem justified, but it's just because you took the time to look at them in the eye and have a conversation and acknowledge our common humanity, Uh,
Perfect. From your personal view, uh, MSF now has been working for 5 decades. How do you see the role of MSF during this long time period of action?
It's a complicated question. How five decades, and when you look at the needs, you think of I wish we weren't needed anymore. But when we see the continued level of and the continued number of populations that are deliberately neglected and whose access to care who are deliberately excluded from access to care, when we see populations on the move, when we see populations that are displaced by conflict, when we see the impact that insufficiently cared for health services or vaccination drives in certain areas leaves entire pockets of population without the assistance that they should be getting. It's hard to think of a moment where we wouldn't be needed, and that's where we will continue to try to be of most relevance operationally, to go where it is complicated for others to go, and where states deliberately exclude populations' access to care, or other actors as well in armed conflict. We'll also continue to go where, because I think what is slightly special, slightly unique about MSF is its commitment to témoignage, to speaking out, to talking about what we see and trying to affect change through our medical and humanitarian assistance, but also through our voice, for whatever it is worth in certain situations. And so wherever we see that our voice can have the most difference, it can have the most leverage, and it can serve to amplify voices of people that are not sufficiently heard, we will continue to do that. But I think there is a dire need today for impartial, independent, and needs-based medical assistance.
We have been facing a pandemic for 1 year now. What do you think is the challenges that MSF is having during 2021 and the upcoming near future?
The pandemic, of course, in its global scale, has affected everyone and has affected us as well. It's affected our ability to travel, to go to certain locations, and most importantly, it's affected, as we were talking about with Northeast Syria, it's affected populations, and it's affected much more strongly populations that were already suffering from insufficient access to healthcare. And with this year on, we're seeing how certain areas that were relatively or that weren't as affected by the COVID pandemic are being much more affected now, particularly countries that were suffering from other issues. So I see COVID will remain, or the pandemic and its snowball effects will continue to be a major challenge, but also a major area where we will be intervening. I think the other one is definitely being able to stay true to our commitment to try to access populations that are most in need. We are seeing, this is not new, but sadly it doesn't change. We see very little respect for the protected nature of medical action, for the fact that anyone in a conflict zone should be able to access care, and those who are there, the professionals who are there to provide care, should not fear for their lives. And that we are seeing throughout the world in very different places, continued harassment and challenges and violence to medical actors and infrastructure. So that will definitely as well remain a challenge.
Could we consider this as one of the wishes you wish for the future of MSF, to medical staff to be safe and not worry about their lives in the conflict areas they are working on. What else would be your future wishes?
Absolutely, that would definitely be a major wish. For the colleagues in MSF and throughout the medical sector and humanitarian action in support of medical care, but also for populations' access to health services. The other wishes would really be that that healthcare and protection is awarded to anyone who needs it, and it is that on the basis of need rather than on any other consideration that health is provided. And I can only wish for the world that we can put the pandemic behind us very soon, and that we can have a little bit more peace and stability throughout the world.
Okay, let's start having questions from the audiences. The first question we have is how you describe the mental burden of working in conflicts like Syria on the frontline workers like you.
That's a very interesting question, and yeah, it is a severe. It is not going into a conflict zone like that and working in the front lines is not is not just routine. So it does impact the mental health of people, and we know and we know that are not immune to that. What we have within MSF, as this is a lot of us work in these situations, we are very cognizant of that and have systems in place to ensure that that we are taking care of ourselves and that the organization is taking care of us, so that we are in the right position and the right state of mind to care for those who need it.
Another question we have is in 10 years of what is happening in Syria, have the needs changed from the beginning of the war and now? Are they the same, increased, became different? What do you think?
They've they've evolved in, I think it's been in waves, and it's depended on the intensity of the conflict. And of course we have a very partial vision, right? Because we are in a certain geographic location as the MSF Holland section in Northeast Syria. So we've seen needs evolve depending on how the conflict has evolved. So for instance, when in stages of heavy fighting in Raqqa, for example, or later in Deir ez-Zor, we saw needs for much more that were related directly to the fighting. So for trauma care, for people who had suffered from bombings, who were emergency care for populations that had been displaced and who had walked for days without food, without water, without shelter, and then in stages where we have not been in active fighting, we've seen the protracted displacement and its impact, the impact that it has of living in a camp as a family for 2-3 years, and that related to the needs that brings about, and then the health sector, we've seen it struggle to meet the needs of populations that have also been displaced. So there are certain areas where the number of population has severely increased with the displacement, and so health structures that were already struggling as health workers, many of them died. Many of them fled the area. So they were already struggling with that, and then an increase in population through displacement. So we've seen these different stages of the
Can I
war.
ask about the support of the infrastructure, water, food, how these are supported during the last decade? Have been have been there any changes in such a support of this infrastructure? Have been better because of the long time they have been working on, or more deteriorated? This is my
Well,
question, not the audience question. Sorry.
Um, well, so water has been there has been a deterioration in water provision in Northeast Syria, um, and they which has also been impacted during and after the Turkish-led military intervention. So we've actually seen a deterioration in water provision. And we have ourselves been engaging in providing water, to distributing water to areas where it has been most needed. In terms of food, what we've seen is, well, there's been, as I was telling you, so one of the impact of COVID has been the strain that it has put on livelihoods. And so in people's ability, and that has a direct implication on people's ability to feed themselves. Even if it's not on quantity, it's definitely on quality, where people will be tempted to take on negative coping strategies, so spending less on their food basket and buying less meat and fresh vegetables, which will have an impact. Food distribution from by humanitarian actors, for instance, in situations of acute need, is done, but is also constrained, as we've seen with WFP, for example, by the fact that they require authorizations from Damascus that are not always granted.
And is there agriculture in the north of Syria? Is there people working on feeding themselves, not just depending on the aids?
There are beautiful fields in Northeast Syria, but
Yeah, I know.
they've also suffered from the war.
Yeah.
Mining, so mines and booby traps placed in on fields have impacted people's ability to be able to work on those fields. There's also been displacement, which has impacted that. So there is production, but it is insufficient, and it is impacted by a number of factors related to the war and to its secondary impact.
Another question from the audience. They are asking about the medications. What kind of medications you support people there with, and what you did about COVID there,
All right.
particularly the medications.
Okay. Well, in terms of medication, we provide the medication that is needed for the specific condition that comes to us. So, as I said, for example, with non-communicable diseases, chronic illnesses, these are morbidities that are quite widespread in the area, and that have insufficient ability to medication. So this is the type of medication, or one of the examples of the type of medication that we're able to provide. In terms of COVID, as I mentioned, we are supporting 2 COVID treatment centers, one in Raqqa, one in Hasakeh, and we're also supporting with community engagement on managing the pandemic and ensuring people's access to information and case management.
Another question here, maybe it's not its time yet, as there aren't yet any vaccination for COVID available for the north east of Syria, but they are asking about the awareness of the vaccines. Is there campaigns for awareness for the importance of the vaccine for COVID, or because there are a lot of rumors, a lot of anti-vaccination campaigns, particularly for COVID? How MSF is working towards this kind of awareness?
So, as you say, it's a bit early to answer that question, as vaccination drives have not started in any scale in Northeast Syria. We are very conscious or following very closely the rumors around and the sentiments around vaccination, because this is obviously something that is very important, that people feel comfortable and feel that they have the adequate access to information. So we have been communicating on COVID in general, not vaccination in particular, very widely. But we've also been monitoring to see if we are seeing any rumors. For the moment, not so much actually. We are not seeing in Northeast Syria, but again, we're a drop in the ocean. We are not seeing any widespread rumors on the vaccine, related to the vaccine.
Mm-hmm. Okay. Before the last question, someone is asking, does Sophie follow the Syrian crisis outside Syria, about the conditions of refugees on the move? And they are asking what you say about this crisis as we are approaching another World Refugees Day.
Indeed, it's we follow closely through our operations the situation of the Syrian population that has been forced to fled their homes and the borders of Syria. MSF Holland is not itself operational in all of the areas where there are Syrian refugees, so in Lebanon or in Turkey, but we are following closely. Where we are, however, is on the, or where we've been quite a bit, is on the Mediterranean, particularly in the early years where Syrian families were fleeing towards safety. It's refugee crises and looking back at, or looking every year at World Refugee Day and thinking about the crisis of refugee, what strikes us, and I don't think it's new, but it is worth mentioning, is how protracted every refugee crisis seems to be. The Syrian war is now over 10 years old. Refugees have been living in limbo for years now, and the response and the mechanisms of both the international community and the states from which these populations are forced to flee remain inadequate.
Mm-hmm. Another question, actually, it's for me, about the media coverage. How do you think the media coverage is doing well in covering humanitarian situation in such conflict areas? And what do you think the organizations like MSF is missing in accessing information for media?
In accessing information for media, You mean from the media, information from the
Yeah.
media for MSF?
I mean mainly, how do you give access for data? You are witnesses in such conflict areas. How do you let the media access the information? Uh, are you doing your role in this for the optimum, or do you think there's much more that you can give? And also, how do you act? What's your assessment to the media coverage for humanitarian aid, particularly in conflict areas?
It's a complex question, and I'll try to do justice to it, but I'm not sure. I'm not sure I can. What I'm seeing is that in a number of locations in Northeast Syria, but also in Yemen, these are places where access is often severely constrained, also for media, and so humanitarian organizations find themselves a little bit alone there. And we have as you say, we have a voice, we have a responsibility to voice out what we see and what we think are the needs are, what we think is unacceptable. But we also should not confuse our roles, right? We are not media actors,
Yeah.
and we want to safeguard as well for the populations our ability to be able to access them. So what I can say is that we miss the media around, because they're sparring partners in those areas, because we both do different but eminently complementary work.
Okay. And how do you assess the media coverage in such areas? Do you think they are doing their role? There are something miss. What do you think?
I think there's much more that can be done in terms of, but that is a reflection on many war zones. It is there's usually a we hear the sensationalist media, we hear the coverage, the coverage when, and which is normal, we hear the coverage when of the COVID pandemic, of the military-led interventions, of massive displacement, and that is normal and that is good. But I think there is much more that can be done in terms of covering the day-to-day lives and the day-to-day impact, that kind of insidious impact that war and instability have on populations, have on families.
So I think you are asking the media to be more humanitarian, to be feeling the humans themselves and their lives affected by such conflicts. Um, very,
I think, yeah,
very impressive.
there's an I think, yeah, there's an expression of our of humanity that is that is important, that is important to share with the world, of what it is like, without the sensationalism around it, what it is like to live through these conditions, and to live through these conditions over the long term.
Just one last question about Libya. Someone is asking if you have any information about what MSF is doing in Libya. Do you have an idea, or should skip this question?
I'm definitely not the best placed, but to not leave this question without an answer, we are working with migrant populations, or populations on the move, that go through Libya. We are providing care in a number of areas there. And we also are providing assistance well, very soon we will be back on the Mediterranean Sea with a boat, providing assistance to populations, people on the move that have been left drifting on the Mediterranean and in need of assistance.
I think we also can check the msf.org website for more information about both Libya and Syria, so
Definitely.
our audience could know more. Yeah, let me end up with a future wish. When you were talking about your wishes, you messed up saying any wish for North Syria. So what do you think of ending up with a wish for this particular place in the world?
Well, for Northeast Syria, I wish peace. I wish that people can return to their homes and can start up their lives again. I wish children can go back to school and not live war continuously. I wish that the population in Al Hol, those that come from elsewhere, from Syria as well, can go back to their homes and can stop living in open air prisons. And I wish that things can get a little bit back to normal for everyone.
Thank you very much, Sophie. It has been an interesting interview. I liked it very much. Thank you very much, and thanks for MSF efforts in most of the conflict areas around the world. Thank you very much for our audience, and I hope we can meet again soon in another interview. Thank you.
Absolutely.
Bye-bye.
Thank you so much.
Thank you.
It's been a pleasure.